Hi everybody, welcome to Addiction Questions and Answers. My name is Emmanuel John. I'm an author, psychotherapist with over 30 years experience in the addiction treatment field. I've worked in every modality there is, from elementary schools to intensive long-term 18-month treatment programs. We'll get to more of that in a minute. In reference to today's question, Sherry from Pennsylvania asked, what kind of treatment does my son need? She's referring to a 30-year-old son who's been out of the house about 8 years. The question is one I get a lot. It's one of the reasons why I wrote the book, Addiction, Why They Use. That was to answer a lot of the questions that I heard over and over and over again. Obviously, people call up on the phone with a question like that all the time. It's an important question, nonetheless. I like to use, back in the 80s, we had, in the late 80s, early 90s, we had a patient placement criteria developed by the Addiction Society, American Society of Addiction Medicine, ASAM criteria, it was called at the time, patient placement criteria, which goes right with the question that was asked today. A lot of times when we think treatment, we think, let's get them in treatment, let's get them on a plane, on a bus, on a car, let's send them off for 30 days and get them some help. Inpatient 30-day treatment is a fairly high level of care. We don't want to start with the highest level of care. We want the individual, the using individual, to start with the minimal amount of treatment that they need and see how they progress through that. What that might mean, maybe they go to a couple meetings and they see if they get a message from that. That's a great place to start. It's a great place to start anywhere along the spectrum of use. 12-step programs will be a valuable, indispensable part of any long-term recovery effort. It's just the way it is. The only other way is very intensive connection with a spiritual community, a church, any type of spiritual activity, but it would have to be 3 to 4 or 5 times a week involvement, so it's hard to do. So what do? We don't just send Sherry's son off to treatment for 30 days. What I would do if someone brought or called me up with that same question, I would say, well, has he been to a meeting yet? Might be a place to start. Has he ever seen a counselor with addictions experience? And that's important, addictions experience, not just people who've worked with a couple addicts. It's a very sophisticated illness, a very sophisticated disease. So first thing I would do is ask if they've been in any meetings. They might say yes, they might say no. Have they ever met with addictions counselor? How'd they do with that? They went to 3 sessions and then they stopped going. Okay, that's called a fail. If the meetings couldn't get them sober the first time, that's a fail. Then we move up to the next level. So they meet with an addictions counselor, therapist. That's a fail. So then maybe we get them to an outpatient drug treatment program where they'll be involved in individual and group sessions once, twice, 3 times a week. Usually anything below 6 hours or less is non-intensive, and anything 9 hours or more is intensive outpatient. There are programs, intensive outpatient treatment programs, and they're valuable, that can be 5 days a week, 3 to 5 hours a day. So what we do is we move them through each phase. If they failed at the outpatient treatments, both of them non-intensive and intensive, then we would recommend the inpatient drug treatment. Another question that I get all the time that goes along with this is, how much should I spend? My answer to that is usually quite simple. Whatever the using individual can afford. Spending $30,000 or $40,000 for treatment is not necessarily a solution. In fact, I believe it can work against the individual for success. The last thing we want is a respite escape from the realities of the problem by sending someone to a program. It's basically going to be like a holiday where they're going to experience rest, relaxation, and escape. They're going to have to go back to their real world one day. And while some of those treatments have some valuable insights for trauma and some of the core issues, we have to deal with addiction with the first things first. We have to stop using. So what does that mean on top of all the ones I just mentioned a lot of time? Is detox programs, some program to help the person through the physical symptoms. Personally, I write about this a lot in the books. I am more of the spirit sort of a therapist. I am more of the cognitive aspects of it. I do not treat the physical body. I get doctors to help me with that if necessary, if required. There's a lot we can get into about that, and we'll probably talk about opiates, I'm sure, in a future question or so. So What do we do first? We start with the lower levels of treatment. We move them on successively as they fail. And I know it sounds negative when I'm saying fail. Those failures are important, extremely valuable concepts for the using person to grasp, mostly because they're going to look at their unmanageability. I tried counseling, I failed. I tried meetings, I failed. I tried the outpatient treatment program, I failed. By the time they get to a long-term or a 30-day treatment program, they don't have a lot left on the table, a lot of options, so they need to take it serious. And then there's the long-term 90-day treatment programs, 30 days with 6 months or a year of aftercare programs. There are programs that you go in for 18 months. I was a clinical supervisor of one of those for quite a while. It was a forensic-based program, but it was out in the community, available to others as well. So what do? Yes, we want to get them help. Don't call the treatment programs for your son or daughter. It is an almost instant rejection from the program when mom calls, when dad calls, when wife calls. You say, oh, my wife wants to get help. My son needs to get help. The first thing you're going to hear, and it's one of the most important things they could tell you, get them to call. If they're not able to pick up the phone, they're not serious. If they can't call the counselor, if they can't find out where the meetings are, they're not serious. They need to get serious. These failures help them see serious, but as long as you're doing it for them, you are making it easy. I'll end with a simple definition that I use all the time. It's about enabling. People say, am I enabling? If I send them to treatment, am I enabling? If I'm helping them get the treatment, am I enabling? Enabling is most simply defined as any behavior that insulates the addict or user from the consequences of their use. Okay? Anything that you do that makes what they did easier is enabling. They have got to experience the full extent of their unmanageability. And all of the programs I mentioned just previously are important. So make sure that the counselors have experience, years experience, the more the better. While my heart goes out to all the new therapists with a year experience treating addicts, if it's my son, if it's my daughter, I want someone with 10, 20, 30 years experience. They don't necessarily need to be in recovery. It's a valuable tool to have, but it's not the only tool a therapist uses. So personal recovery is important, but a lot of times that tends to be less therapy and more recovery. So it's a fine balance. You have to figure it out for the individual. Get them on the phone, get them to meet with a person, and help them get placed. Again, thanks for the question, Sherry. I hope that helped. You can always email me with your questions. You can IM me if you're seeing this on Facebook, or you can visit the page addictioninthefamily.com. Addictioninthefamily.com. There's links there to the books, the 2 books, Addiction: Why They Use, a handbook for anyone who loves an alcoholic or addict, and Addiction and My Powers, a self-assessment guide, a user's tool to the truth. So check it out. Keep the questions coming, and I'll keep answering them to the best I can. Time's limited a little bit with these, so hope that helps, and hope you have a great weekend. Thanks. Bye.